Hi, my name is Maria Evanel R. Noveno from PLM College of Nursing, and I will be performing open gloving technique. So the first thing we need to do is to perform proper hand hygiene to prevent the spread of microorganisms. If your hands are visibly soiled, then you should wash with soap and water, but if not, then alcohol would suffice. Also, remove all your jewelries and make sure that your nails are kept short to avoid puncturing the glove. Okay, now check if the sterile glove package is unopened and dry because moisture contaminates the sterile glove package, and also check its expiration date and note if it is still valid because that would indicate the period that the package remains sterile. So mine says April 2025. Also check the size of the sterile gloves because you don't want your gloves to be too loose or too tight on your hands. So mine is size 7. Now, place the sterile glove package on a clean dry surface at or above the waist. Because moisture contaminates the sterile glove package, and any sterile object held below the waist is considered contaminated. Now, open the outside wrapper by carefully peeling the top layer back. Then, remove the inner package, handling only the outside of it. So, this maintains the sterility of the gloves inside the inner package. Now, place the inner package on the work surface with the side labeled cuff end closest to the body. This allows for ease of glove application. Then, carefully open the inner package by using the sterile technique and expose the glove. Touch the fold to open the top flap, then the bottom, and the sides. Take care not to touch the inner surface of the package or the gloves, because the inner surface of the package is considered sterile and the outer 1-inch border of the package is considered contaminated. Now, with the thumb and forefinger of the non-dominant hand, grasp the folded cuff for the glove of the dominant hand, touching only the exposed inside of it, because unsterile hands should only touch the inside of the gloves and the outside should remain sterile. Now, keeping the hands above the waistline, lift and hold the glove up and off the inner package, and be careful that it does not touch any unsterile object because the gloves are contaminated once it touches any unsterile object. Also remember to keep the fingers down. Now, carefully insert the dominant hand palm up into the glove. Okay, so only touch the exposed inside. Now, insert the hands. Okay, so leave the cuffs folded until the opposite hand is also gloved, because attempting to turn upward with the unsterile hands might contaminate the glove. Then, hold the thumb of the gloved hand outward and place the fingers of the gloved hand inside the cuff of the remaining glove. Lift it from the wrapper and take care not to touch anything with the gloves or the hands. Okay, so This is done because with the thumb held outward, it is less likely to get contaminated, and sterile surfaces touching sterile surfaces prevents contamination. Now, carefully insert the non-dominant hand into the glove and pull the glove on. Take care not to touch anything with the skin or the skin to the outer surface of the gloves because sterile surfaces touching sterile surfaces prevents contamination. Now, slide the fingers of the one hand into the cuff of the other and fully extend the cuff down the arm, touching only the sterile outside of the gloves. Now, repeat it for the remaining hand. So, this is done because sterile surfaces touching sterile surfaces prevents contamination. Now, adjust the gloves on both hands if necessary, touching only the sterile areas with the other sterile areas. This is done because sterile surfaces touching sterile surfaces prevents contamination. Now let us assume that these are soiled gloves and they are already used. Let us perform removal of soiled gloves because proper removal techniques helps in preventing the spread of pathogens from the gloves to the skin surface. Now, the first thing we need to do is to use the dominant hand to grasp the opposite glove near the cuff end on the outside exposed area. Then avoid allowing the outer surface of the glove to buckle inward against the wrist. Then remove it by pulling it off downward, allowing the glove to turn inside out as it comes off, inverting it as it is pulled. So this keeps the contaminated area on the inside. Now hold the removed glove on the or in the remaining gloved hand. So this is done so that the contaminated area does not come in any contact with the hands or the wrist. Now, slide the fingers of the ungloved hand between the remaining glove and the wrist. Take care to avoid touching the outer surface of the glove and folding it inward against the wrist. Then remove it by pulling it off downward, allowing the glove to turn inside out as it comes off, inverting it as it is pulled. So keep pulling or continue pulling until the left glove completely encloses the other glove. And the uncontaminated inner surface is facing out. This keeps the contaminated area on the inside and secures the first glove into the second. So this is done so that the contaminated area does not come in any contact with the hands or the wrist. Now, discard the used gloves in its proper container and perform proper hand hygiene. So proper disposal of the used gloves reduces the risk of infection transmission and contamination of the other items, and performing proper hand hygiene prevents the risk of spreading microorganisms. So that's all for open gloving technique. Again, my name is Maria Evanel R. Noveno from PLM College of Nursing. Thank you for watching.